Dr. Gavey first. He received his BA from Yale University, his MS in biochemistry from Emory University, my home in Atlanta, Georgia, and his MD from the University of Maryland. He's currently the president. We say here the president-elect, but that's not true. He got upgraded since this was printed. He's the president of the American Holistic Medical Association, and you can read in your program the long list of further contributions that he's made. Dr. Wright, educated at Harvard, and it didn't ruin him, I'm delighted to say. He has been a columnist for Prevention Magazine for a decade, from 1976 to 1986, and from 1986 to today is a columnist for Let's Live magazine. He says, that was a pretty good name. He liked it a lot better than their first choice, Let's Not Die. No, I agree. I like Let's Live. And again, if I tried to tell you just a fraction of what these men have accomplished, I'd be up here for the next 2 hours, and you wouldn't hear what you came for. So I'm just going to say, we couldn't be more proud of the information you're going to get and the people we're going to present. Dr. Jonathan Wright and Dr. Alan Gavey, thank you.
Thank you, Chib. And thank you all for coming back instead of going to the beach. I know that was a reasonable choice. Jonathan and I have been going around for about 11 years now giving seminars, primarily to medical practitioners. We've also spoken to, I guess, do you call yourselves the public? No, you're not the public. You're like a class well above the public. Thank you. Okay. I'm happy to be here to speak on alternative medicine, but I'd like to talk about nomenclature first, because I always wonder, why is this alternative? I learned when I was going through medicine, we try to find the most effective, least expensive, least dangerous treatments available. And I think what we're doing in our medical practices and promoting satisfies that. And therefore, what are we an alternative to? Institutionalized mediocrity, I believe, is the proper terminology for conventional medicine. And reporters are calling up these days and asking, what is alternative medicine? And I think, well, maybe it's acupuncture and vitamins and homeopathy. And then I think, well, it's really the stuff that the people in power don't like. That's by definition what alternative medicine is. But I would like to tell you that we have advanced politically, because 500 years ago, they would have killed us for saying this. And now all they do is try to take our licenses away and call us quacks. So it is reassuring that we are becoming more civilized. And I think in the future, with the dissemination of information that is available today, with CD-ROMs and computers and modems and fax machines, I don't think it's going to be possible to keep this information down any longer. And furthermore, at the same time this information revolution is occurring, there's also a revolution in scientific research. And many of the so-called folk remedies that were called old wives' tales, and that was always considered a derogatory term, old wives' tales, and yet I learned from an elderly medical practitioner that our wives and mothers and grandmothers know a lot more medicine than the doctors do in many cases. So the old wives' tales are now being documented as effective using the standard double-blind research methodology, and we'll talk to you about that some today. So, what can you do with nutrition? Interestingly, fortunately, there's a lot of self-care that people can do. And that's real important, because today when you go to the doctor, it costs a couple $100s to walk in the door. And then you get a couple $100s worth of tests, and then they find something that might be wrong, and you get stuck with another couple $100s worth of tests. And then you get side effects from the tests, and you got to have $1,000 of hospitalization because of the side effects from the tests, and then they give you medications for the side effects, and then you get in the hospital again from that. So if you were to just do something simple in the first place, you might not get in the medical system in the first place. And I think our goal as practitioners and as doctors, the term doctor comes from Latin meaning docere, which means to teach. It doesn't mean to stick a needle in your back, it means to teach. So doctors should teach people how to stay well, and when you get sick, to find the least invasive method possible to get well. Hippocrates, who was the father of traditional medicine, and again, nomenclature, let's make sure we define what is traditional medicine. It's not cortisone and antibiotics. It's Hippocrates, it's ancient Chinese medicine, it's herbs. Hippocrates said, let your food be your medicine and let your medicine be your food. Now, my Uncle Reuben said something like that, too, at the age of 94. He said, health comes from the farm, not the pharmacy. And we need to keep that in mind. So what do? We clean up our diet, we keep a good attitude, we exercise, we take vitamins, minerals, plant products, also called herbs, and we do our best to stay away from the modern chemicals that are so expensive and so dangerous. So the first thing someone does when they come into my office is they get a dietary questionnaire and we find out what they're doing wrong. If someone is not feeling well, you can generally assume that if you persuade them to get all the sweets out of their diet and all of the caffeine and all of the alcohol, that 50% of the time things are going to get better. Now that may not be intellectually satisfying to an internist, but it's emotionally satisfying to someone whose interest is getting you well and to you whose interest is in getting well. So that's free advice. And it's also not that easy to follow because we're dealing with 3 addictive substances: sugar, caffeine, and alcohol. We know about alcohol addiction. Many of us don't think of caffeine in terms of an addictive problem. But how many of you find that if you get off of caffeine, you get a blistering, horrible headache and it lasts about 2 days? Okay, and those of you who weren't willing to raise your hand, I know who you are. Anyway, caffeine, sugar, and alcohol, they are what we call blood sugar destabilizers. They cause the blood sugar to bounce up and down. They cause many other changes in our body chemistry. And the symptoms that we see improve range anywhere from fatigue and depression and joint aches to chronic headaches, both migraine and tension headaches, joint pains, frequent urination, bowel problems, many common things that are called psychosomatic. You've heard that term. The doctor told me it's psychosomatic means there's nothing wrong with me. It's in your head. It's all in your head. But you're supposed to go back and say, oh yeah, there's something wrong with me. You just aren't smart enough to figure it out. Well, this is really not a medical intervention. It's a lifestyle change. But our observations over the years have been, if you get those things out of your diet, you're likely to feel better. The second level of investigation on lifestyle change is about allergies to commonly consumed foods. Now, I know you all remember hearing that whole wheat's good for you, and Cal Ripken up in my area in Baltimore says drink milk every day, and he looks big and strong, and he won the Most Valuable Player Award. But a lot of times these foods that we are conditioned to believe are good for us are in fact causing persistent daily allergic reactions. And some good doctors have written that as much as 60% of the symptoms that we see in a family practice setting that are not properly diagnosed and adequately treated are due to allergic reactions to common foods. Now, what are the foods that we frequently get reactions to? Wheat. Everybody has wheat. Some people have it at every meal. It's in bread, it's in noodles, it's in spaghetti, pasta, and then it's used as a filler in a lot of different things. The second most common is dairy products, which is in cheese and milk and yogurt and many baked goods. And then, believe it or not, corn is a significant problem for food allergies. And, well, we don't think about eating corn a lot, but if you look at the labels and see corn starch, corn syrup, corn oil, vegetable oil, which is usually corn oil, and a lot of times corn is just used as an additive in one way or another. Then we look at eggs as a common problem, also used as an additive in many foods. Citrus fruits, which we typically think, particularly the Floridians, believe that, a lot of vitamin C, a lot of potassium, it's good for you. Yes, indeed, unless you're allergic to it. And then coffee and tea, and then one last list called chemicals, which include between 3,000 and 5,000 things that are added to our food. So what we do, and there are ways to do this yourself, I suppose you should have some kind of medical supervision, but there are books that tell you how to do an elimination diet. You cut out wheat, dairy, corn, eggs, citrus, coffee, tea, and alcohol, sugars, and all of the chemicals. And if you suffer from chronic migraine headaches, chronic fatigue, osteoarthritis, 50% of the time improves with this, rheumatoid arthritis, if you're young, in your 30s, and have just had it for a while, it goes away almost every time with this approach. If you're older and have rheumatoid arthritis that's been somewhat crippling, it often gets better, although it doesn't go away. Asthma, 75% of the time in children, 35% of the time in adults, gets substantially better using this approach. Various bowel problems, the so-called irritable bowel syndrome. Have you ever heard that term, irritable bowel syndrome? What does that mean? Irritable bowel. It's a medical term. It means your bowel is irritable. Thank you, Doc. I told you that. It's sort of like saying, Doc, I'm swollen and I don't know why. And the doctor does an evaluation and says, you have idiopathic edema. And you say, what's that mean? He says, it means you're swollen and I don't know why. So irritable bowel syndrome is a bunch of symptoms: bloating, gas, constipation, diarrhea, pain, things like that. It is very common. It's the most common gastrointestinal symptom or condition. And they do an upper GI and a lower GI and say, gee, I don't know. You've got irritable bowel syndrome. Well, it's a process. Why is the bowel irritable? It's because we are exposing it to allergens day in and day out. And in one study published in the Lancet, the British medical journal Lancet, 21 patients who had refractory irritable bowel syndrome, which means the things the doctor had tried hadn't worked, went on an elimination diet similar to what I just described. 14 of the 21 cleared up completely in a matter of a week or two. They then did re-challenges. 14 patients improved. 9 of them were sensitive to wheat. And between 3 and 5 were sensitive to the other foods that I mentioned. And when they stayed away from those foods, they no longer had irritable bowel syndrome. And yes, it's a stress-related condition too, but we find that if you heal your stress, you'll get better, or if you stay away from your allergens, you'll feel better, and therefore you have 2 options for getting well. But a lot of folks will find that if they live a stressful life, they can control the bowel condition by changing their diet. Now in this study, you know, the medical community says you've got to do double-blind studies because a lot of these things are psychological in origin. They did this in this study. They put a nasogastric tube through the nose into the stomach, and they put opaque capsules in there containing food extracts. And every time the patient said a certain food bothered them, when they put an opaque capsule in there with that food in it, they reacted. And when they put an opaque capsule in with a different food in it, they didn't react. So they satisfied the double-blind methodology, and this was back when, 1981, something like that. So it's taking a while for the medical community to catch on, but this is the research that's been published. So after we've looked at the food allergies, and a large proportion of conditions improve. Ear infections in childhood. A lot of you have children or know people who have had frequent ear infections, and they're always taking amoxicillin. And then they get tubes in their ears, which don't really help that much. In fact, they can retard hearing over a period of time. At least 75%, that's a conservative figure, of children with recurrent ear infections can be shown to have allergies to commonly consumed foods. I remember a young patient, 3.5 years old. She was on amoxicillin preventively because every time she went off of it, she'd get another ear infection. This had been going on since the age of 1 for 2.5 years. So she came in, and her mother had had rheumatoid arthritis, which cleared up on an allergy elimination diet. And so she figured, well, maybe my daughter's got food allergies too. And on the elimination diet, she stopped the amoxicillin and had no ear infections. And then after a period of time, we decided to begin challenging her with foods. Everything was okay until she got to corn, and within 1 hour, she was tugging and screaming at her ear, and pus started coming out of the left ear. She was not treated with an antibiotic in this case. We just considered it an allergic reaction, and by the next morning, she was fine. And from that day on, she never had another ear problem, never needed any more antibiotics. She just reads the labels and stays off of corn products. Now, I wrote that up in the Townsend letter and called it an ear of corn. It's still available if you'd like to read that. That's right, I forgot you don't all like jokes, do you? Anyway, so lifestyle modification is very important, and some people are not willing to do that. If you are willing to do it, you can clear up a lot of conditions and prevent a lot of other ones. The next level of things that we do is try to use our own pharmacopoeia, which is, instead of the drugs, the physician's desk reference, which lists all the side effects and weighs about 12 pounds, compared to the natural medicine pharmacopoeia, which has about as many medicines in it and only weighs about 2 pounds, because it doesn't have that many side effects. We like to use herbs and vitamins and minerals and other natural products, and as the day goes on, we'll be mentioning some of those. Probably one of the most exciting new substances is called glucosamine sulfate. Has anyone heard of that? Okay, a few people have. They taught us in medical school that when you get arthritis, osteoarthritis, that's the kind wear and tear, your joints sort of erode away from overuse or age, that it's not reversible. They told us a lot of things in medical school weren't reversible. And then we went digging in the caves in the medical library and pulled out all these journals that were gathering dust, and all these people were saying, we reversed this and we reversed that. But we didn't learn any of that in medical school, so I figured, well, I'd rather practice medicine and have a chance of getting people well than believe what they taught us. So we began trying a bunch of these things, and they worked. And back in the early 80s in Italy, there was research on this substance, glucosamine sulfate, which is a naturally occurring component in the body. It is made in the body from glucose, or sugar, and it is a precursor to manufacture cartilage. So if you don't have enough glucosamine around, you can't make new cartilage, and then you'll be more in a breakdown state than in a build-up state, and your cartilage will fall apart, and your arthritis will get worse. So they figured, well, let's try having people swallow glucosamine sulfate. And lo and behold, osteoarthritis got better. And they've done some controlled studies here. A double-blind study is where half the people get a fake and half the people get the real thing, and you're not allowed to know which is which because that eliminates any possible psychological benefit. Well, in one study, they gave half the people glucosamine and half the people placebo, and the ones that got the glucosamine, and I use that interchangeably with glucosamine sulfate because it's a similar product. Those that got the active ingredient had improvement in pain, joint range of motion, general well-being, stiffness, etc., compared to those that got the placebo. Then they thought they would compare it to ibuprofen, which is a standard anti-inflammatory drug. You've all heard of ibuprofen. It's Motrin, Advil, Nuprin. It's very similar to aspirin. It's similar to Feldene, Anaprox, a bunch of drugs like that. They're called non-steroidal anti-inflammatory drugs, NSAIDs. You may have heard that term. Well, in fact, because they're not any better than aspirin and have the same side effects and just cost 10 times as much, they should appropriately be called NSAIDs, meaning new sorts of aspirin in disguise. But that's what they call them, NSAIDs. And in one study, they compared glucosamine sulfate to ibuprofen. And after 4 weeks, actually the ibuprofen worked better in the beginning because it's a pain reliever and it's an anti-inflammatory, whereas glucosamine sulfate only helps you restore healthy cartilage. So after 4 weeks, the glucosamine caught up. It was like the hare and the tortoise thing. And after 8 weeks, there was a statistically significant advantage to the glucosamine sulfate over the ibuprofen. And then they did some biopsies of the joint cartilage, and the ibuprofen group had deranged cartilage, which was in a breakdown, diseased state, and the glucosamine sulfate group was in the healing state, and there was a lot more normal cartilage. So here's something very simple. It's now available over the counter in the United States, 500 milligrams 3 times a day. There is no known toxicity, and there is no known interactions with prescription drugs. Contrast that to the anti-inflammatory drugs, which have a high risk of bleeding peptic ulcer, bankruptcy of the pocketbook if you're not covered in insurance, and a small risk of kidney failure. And fortunately, the risk is small, but that's such a horrible thing to develop that one wonders whether one should ever take the risk unless your joints are just doing very poorly. So I'm going to turn it over to Jonathan now, and as we progress through the day, we'll try to give you as much information about the so-called alternative good practices of medicine that we can. And we thought we would leave the last 30 minutes today for questions, so we would appreciate that we not have any questions this morning. Dr. Wright. Thank you.
Thanks, Alan. What Alan's talked about already, namely asking folks not to eat sugar, white flour, food, chemicals, and so forth, might sound like it was elementary, but how many people can tell us that you don't eat any sugar or white flour or food chemicals and haven't done that for the last couple of years? Have we got any volunteers? Good, there's a couple in the back. So even though it seems elementary, it's awful hard to do, isn't it? Got to read all those labels. You have to look at when they bring in the desserts and say, you got any sugar-free dessert? And the waiter says, sure, Mom, or whatever they say here. But it really is important if we're trying to stay as healthy as we can for as long as we can. I try to convince people to get off sugar in various ways. One of the ways that's more successful is by referring people to research published in Scientific American that showed that sugar accelerates aging. Has anyone read about that? Alan will have to tell you about the slightly involved chemical reaction if he wants to later. But it turns out that what sugar does when it gets loose in excess in our systems, and I don't mean we have to be diabetic either, but what it does is it forms rather stiff linkages with particularly the protein molecules in our systems, so that those protein molecules no longer can slide back and forth and bend and twist and so forth. Literally what the sugar does is to stiffen the tissues that it's attached to. And once that sugar molecule gets stuck onto that particular protein, it's a process called glycosylation. Once it gets stuck on there, it stays until that protein is ultimately broken down and excreted by the body. The evidence that sugar accelerates aging is very, very, very strong. It's not just maybe. This was an article in Scientific American just 3 or 4 years back. So maybe if we can't quit eating sugar because it gives us holes in our teeth or because we might get diabetes or whatever, maybe we can be talked into it because, hey, we're aging fast enough anyway. Who wants to do it any faster? That evidence is real solid. Now, Chip did say I was going to mention something about FDA. I'm going to save that for later on, too. I'll just tell you now that if you ever get bored with what you're doing, boy, is that a way to break up an average clinic day. You know? This just really shook us right out of our rut there. Another thing that we have folks take a look at a lot when they check into the clinic is the question of whether food is really being digested and assimilated into the system properly. Now that's another real important one. Folks come by and they talk to Alan, myself, and other practitioners at this, and they think we're going to start right out with, oh yeah, you need some zinc, and how about a little coenzyme Q10, and so on and so on. A whole lot of things can be cleared up just by looking at the basics, getting the food chemicals out, getting the sugar out, reading those labels, staying away from our allergies. I definitely second the motion that about 50 to 60% of undiagnosed symptoms, I didn't say all symptoms, but symptoms that haven't been diagnosed easily elsewhere, have to do with just reactivity and allergy. Just for example, if you keep getting infections, you're allergic. It's very, very, very axiomatic that if someone comes in and says, look, my immune system must be down, I keep getting infections, doesn't matter whether it's a child with earaches or someone who keeps catching colds and the flu or whatever it might be, we always look for the allergies and they're always there. Allergies occupy a lot of the energy of our immune systems. So we work on that. But particularly for those of us who are possibly past 40, anybody in here past 40? I am. We have to take a very, very hard look at the question of, is everything getting digested as well as it should? And is it getting assimilated into the system so that our bodies can make some use of all of this nutrition? How many antacid commercials have you all gotten disgusted by? You turn on the TV, there's an antacid commercial, right? Well, something we've found over the last 20 years is that if we happen to be over 40 and we're getting heartburn and think we need antacids, nonsense. 9 times out of 10, that's exactly 180 degrees in the wrong direction. And look at all the stuff they're selling out there for antacids. If a person's not digesting, if they're getting heartburn, does this mean there's too much acid down there? Have you ever been told that? And has ever anyone gotten their stomach acid measured? No, you go see the doctor and it's almost a knee-jerk response. Oh, yeah, you got acid indigestion. Well, I'm here to say not at all. We do a lot of measuring of stomach acid and pepsin. We do a lot of measuring of digestive enzymes that are made by the pancreas. And over and over and over again, we find out that all these folks who come in with their various antacids, we tell them after we're done with the measurement, hey, you need some of those hydrochloric acid and pepsin capsules. They say, what? I've been taking antacid, you want me to drop acid? What are you, some hippie? No, this is hydrochloric acid. It's the stuff everybody's stomach's supposed to make. Now, I won't stay on this for ever and ever and ever because For the folks who bought one of my books here, there's a chapter in there about good digestion and what all it means and so forth, and I tried to keep it real short. Alan and I do like to cite various medical journal articles, and a couple that we dug up come from Mayo Clinic, which is still in business and will be in business until after the Clinton Health Care Plan goes into effect, and after that they probably won't be with us if that thing gets through. And another article from Johns Hopkins University. Now, I think we've all heard of those two places. These articles were published in the 1930s. And what they did was to report on some 3,000 in one case and some 4,000 in some in another case, folks who'd had, and this is just the stomach part of the digestion. Remember, we got more in the stomach on us, but who'd had their stomach acidity measured to see if it was up to the amount required to fully digest dinner. What they found is by the time we all get to be 40, 1/3 of us aren't doing the job properly. And by the time we all get to be 60, it's just about 50%. And by the time we get to be 80, it's up there around 80%. Why? It's almost 1% per year of slowdown on the production of acid and pepsin by the stomach. So what difference does this make? Well, if we don't make the acid and pepsin properly, we don't just digest proteins. Let's start with that. And let me take a little detour into a common condition called depression. Now, there was an article in the paper the other day that said the latest research findings are that half of everyone in the whole United States is depressed. Now, I didn't believe that article because there were 3 authors, which means that 1.5 of them had to be depressed. And how can I believe an article written by depressed people about depression? But that's what they had to say. And then if you looked a little harder, you find out that these are folks who just happen to prescribe antidepressant drugs, and just happen to own stock in the company that makes them. Well, okay, there's that. But there are a fair number of folks who come in and say, well, I'm 50 and I'm just kind of feeling down, and my wife has finally convinced me I'm a little depressed. It's not that she doesn't turn me on anymore, I'm just a little depressed. And so what we'll do is we'll measure what are called amino acids. Remember those amino acids that get digested out of protein by a normally functioning stomach with acid and pepsin? We measure amino acids in the bloodstream. Now, very fortunately, there's only 8 essential amino acids. There's hundreds of amino acids in the body. If we had to measure them all, I don't know if I could keep up with it, but there's only 8 essential ones, and supposedly our bodies can take those 8 and make everything else. Well, we'll measure the amino acids in the bloodstream of somebody who is a little depressed, and over and over and over again, out of those 8 essential amino acids, 1, 2, 4, 5, 6, in some cases, all 8 will be low. And we'll say, okay, well, let's have this formulation made up with the amino acids you need and take it for a while and see what happens. Now remember, amino acids turn back into protein. If we eat chicken, we don't come out looking like chickens in 2 years. Our bodies are supposed to disassemble the chicken protein into those amino acids and then absorb the amino acids and turn them back into people protein. That's what they're supposed to do. We'll measure these amino acids in depressed folks and they're low. Not only do amino acids turn into muscle and connective tissue, but they turn into those little gadgets called neurotransmitters up here in the brain. And all that antidepressant drugs do is monkey with our neurotransmitters. There's one category of antidepressant drug that has as its one useful effect preventing the breakdown of neurotransmitters in the brain. And it has all these other side effects. And as you may have heard, there is no such thing as a side effect. There are simply effects. There's the ones we like and there's the ones we don't like, and we call those ones side effects. But anyway, this antidepressant has one useful effect, if you can call it that. It stops the breakdown, it slows the breakdown of neurotransmitters, and it gives you all these neat other effects that you can read about in the book. And then there's another type of antidepressant. It's the most popularly prescribed one now, named after somebody named Zach. Remember him? Zach was depressed, so they gave him an antidepressant, called it Prozac, right? Okay. Bad joke, worse than Alan's. But I couldn't think of anything else. So that one, what that does is it makes the little neurotransmitters in the brain work harder, pushes them out there, keeps them out working longer, and has all these other neat side effects. So what we're doing in one case is getting the little neurotransmitter to work harder. We're whipping a tired neurotransmitter. In the other case, we're keeping them from being broken down in the way nature usually does. What's the third way? Make more neurotransmitters. That's easy. And how do our bodies do it? Out of the amino acids that we're supposed to digest out of the protein in our stomachs which aren't working, which gets me back to digestion. There are, over and over again, folks who come in who are depressed, and we can gradually get them off their antidepressants just by getting the correct amino acids into that person's system. And it isn't always that dreaded amino acid L-tryptophan that you can only take in Canada. I am writing a professional paper entitled The Effect of the 49th Parallel on Tryptophan Metabolism. You realize that when you cross the 49th parallel into Canada, suddenly you can metabolize tryptophan safely, and it won't hurt you one little bit. It will cost you, though, $70 Canadian, where before it went on prescription, you could buy it in the health food store in Canada for $15, which might give you a clue as to why it's not in the health food store in the United States, where it also costs $15. But there are many others that work against depression. So, besides those 8 amino acids, there are approximately, at last time we counted, at least among the folks in our clinic, approximately 13 minerals that might be affected by acid and pepsid in the stomach, and 2 of the fairly important B vitamins, vitamin B12 and folic acid. They don't assimilate too well if a stomach isn't working. So here we have 8 essential amino acids, 13 minerals, and 2 B vitamins, and if we add that all up, what do we get? 23 essential nutrients that we might not be getting in there if just one part of the digestion isn't working, namely the stomach acid and pepsin. So, hope you can understand why before we start telling folks, well, take this or take that specific nutrient, the first thing we need to make sure of is that the nutrients have a chance of getting in there. So if anyone isn't real certain about how the digestion and assimilation is working, if there are gastrointestinal symptoms, we really need to look at that. Heartburn, particularly heartburn that comes on after age 40, is usually the stomach telling you it needs some help. It's in there dying. It's not making the products it should. And there isn't just stomach digestion, then there's the pancreas, which is supposed to make digestive enzymes. And the digestive enzymes won't substitute for the hydrochloric acid and pepsin, and vice versa. Some people need them both. Another practical example, you all have heard of something called macular degeneration. Now, supposedly, according to the ophthalmology journals, that's those eye doctors, they say that 9% of us, after we get past 70, are going to get this macular degeneration, where the central part of the eye, called the macula, just starts to deteriorate. And one can go blind in that condition, and about 9% of everyone is supposed to. Well, let's not do what we're supposed to do, okay? Turns out that ophthalmologists have recently got on to giving people microdoses of zinc. How do you like that? This is regular medical doctors giving zinc and a little bit of selenium and a tiny bit of vitamin E in tablets or capsules that they call various names such as eye caps and so forth. And sometimes they work and sometimes they don't. Well, I first learned about what to do about macular degeneration by reading the Yakima Valley Herald. It's not one of my favorite medical journals. One of my favorite ones is the National Enquirer. Folks bring it in and I have to keep track of what's going on in there. But the Yakima Valley Herald had an article by Dr. Joseph Bittner who said he had macular degeneration, and he thought he should take some selenium and some vitamin E, and what do you know, his macular degeneration got better. So I asked people to use that, and sometimes it worked and sometimes it didn't. And then after doing considerable more reading and finding that the retina of the eye is an area that is among the very, very richest in zinc in the whole system, right after the hearing apparatus, by the way, decided we'd add some zinc to the program and an amino acid called taurine, which is also found in high concentrations in the eye. And about half of everybody was getting better, and that's better than what was going on. But one day, we had a woman come into the clinic who had been to see her eye doctor about her rapidly failing vision. Hers was going downhill very fast, and was told that she had a very rapidly progressive case of macular degeneration. She also had one other large advantage, I guess you could call it that, and that is a husband who is a CPA. And what kind of advantage is that? Well, the advantage was that her husband had kept a spreadsheet listing every single milligram of everything she had taken for the last 8 to 10 years. She had taken this many units of vitamin E a day for a year, and this many units of this, and this many units of that. Now, on the spreadsheet, she had been taking considerable zinc and considerable selenium and considerable vitamin E. Not very much taurine, but she'd been taking most of those things, and there it was on the spreadsheet. He updated them every year. He'd send in a spreadsheet, and we'd put it in the record, just so we could keep track. And yet her eyes were deteriorating very rapidly. Well, she's about 58. And one of the principles, again, of nutritional type medicine is, gee, if it's a nutrient that ought to work and it isn't working, maybe it's not getting in. So we decided to put it in an IV bottle. You know, when it doesn't work when you swallow it, try injecting it. We put the zinc and the selenium in the IV bottle and started up an IV. The nurse did. And about half an hour later, she yells for the nurse, and the nurse went running in because she thought it was a problem. She says, "I can read the poster across the room." And I couldn't read it when I came in. Well, you know, results like that get you kind of enthused. So we started with just about everybody who wasn't getting better with their zinc and their selenium and their vitamin E and so forth. We started injecting it, and what do you know? Our odds got up around 80% instead of 50. We had someone come in from several states away who told us, if I stand right in front of the interstate highway sign, I can barely make it out. And after 3 IVs a week for 6 weeks, she was reading the newspaper. Well, we wrote that up and published it in a medical journal, and we're told immediately, well, that's not a double-blind study. And we said, well, these folks don't want to go double-blind. And isn't it good enough? Every once in a while I got a good one. Isn't it good enough that you have a record that this person's vision was 20/400 corrected, and now it's 20/50 corrected? Isn't that good enough? But apparently that still isn't thought of as good enough. So we'll just keep on giving folks first a trial of swallow it and see if your eyes get better. And if that doesn't work, let's try injecting it. And by the way, if it works when it's being injected and it didn't work if you were swallowing it, let's look at the digestion, the assimilation. Is the stomach making adequate hydrochloric acid and pepsin? Is the pancreas making enough of the enzymes? Actually, zinc is just as dependent on the pancreas to get into the system as it is dependent on the stomach. And there are many conditions that that happen to us when we get past 40, and many more when we get past 50, and many more when we get past 60. But the first step in the correction, after getting rid of the sugar and the white flour and the food chemicals and the junk, and clearing out the allergies, is making sure that the good food that we're eating is actually getting digested and assimilated into the system as well as we possibly can. Now, even that isn't going to be perfect, so there are a variety of other techniques to get around the digestion assimilation problem. One of them, and then I'll shut up in a moment and we'll go back to our, what do we call it, our colloquy on nutritional therapy, is just simply having people learn to give themselves injections of safe things such as vitamins and some of the minerals at home. A report came out in something called the American Journal of Clinical Nutrition just very, very recently that gave us a real good illustration of why we should be thinking of that. Now, at our clinic, we've had something called the Over 65 Award. It started out as the Over 80 Award, but we've lowered it to 65 in the last few years, and that is if you check into the clinic and you're over 65 and you've got something going on that we can't figure out, We teach you how to give vitamin B complex injections with some B12 and some folic acid. And for people who say, well, isn't B12 and folic acid part of the B complex? We say, yeah, everybody thinks so except for FDA. And FDA won't allow any B12 into the B complex injection or the folic acid. They won't allow that in there either. So we have to have people learn how to take it out of 3 different bottles and pay 3 different manufacturers instead of 1 different manufacturer, which I think was the point to begin with. We just have folks learn how to give their own injections. We'll say, hey, give yourself a shot for 2 weeks, twice a week for a month, and when you come on back, let us know if anything got better. It's remarkable the things that get better with just doing that for any of us who are over 65. Why? Well, let's go back to that article from American Journal of Clinical Nutrition. The academic folks are finally starting to help us out in this field. Things are looking much more hopeful this last 5 to 10 years than they had been before. Why, even Harvard says you should take vitamin E. Well, no, they don't. They say you can prevent heart attack with vitamin E, but it needs further study. That's what they really say. What they said in the American Journal of Clinical Nutrition is if they did a blood test on people between ages 68 and I believe it was 97 or 98, and they looked for the levels of vitamin B12, folic acid, and vitamin B6, only those 3 vitamins, that in one case people were deficient 6% of the time, one case 5%. On being deficient in one of those 3 vitamins, sort of like over at the roulette or whatever the gambling table is, pick 1 out of 3 and you might be deficient on it, it was 19% of people between 68 and 97. Why, that's not a big number, is it? 19%? Well, when you think about it, that's 1 in 5. That's getting to be a good percentage. But then they did something that's much, much more useful. They measured biochemical functions that depend on those vitamins. In other words, not just how much vitamin B6 you got, but what's it doing for you? Is it really conducting all the metabolic processes that it should? Now that actually is fairly simple to measure. There are certain metabolites of common biochemical processes that really start to climb if the B vitamins are not present in a sufficient quantity to get the metabolism to work right. So instead of measuring the vitamin itself, they just measured the level of these metabolites. That just means, as you know, something that a biochemical is changed into ultimately. And what they found is that if they checked metabolites of very common biochemical processes in these same folks, they found that among folks, again, between age 68 and 97, who had no observable signs of disease, and if you read through the article, you'll find that they were pretty careful about screening for disease. They did physical exams, they did blood tests, they couldn't find anything the matter with them. They had another group that was hospitalized too that I'll tell you about in a moment. But in the people who they couldn't find anything the matter with, 63% had signs of an insufficiency of either vitamin B12, folic acid, or B6. 63% of the population between ages 67 and 97. And these are folks who are screened for no disease. And what about the hospitalized group? It was 85% in the hospitalized group. Now, you all know what color vitamin B complex is, especially when it comes through the system. Yellow, that's the riboflavin. And they found that 85% of those folks hospitalized in that age group were deficient in 1 or more of just those 3 B vitamins. Never mind B1 and B2, just those 3 B vitamins. And yet, how many times have you walked into a hospital and seen a yellow IV? Every IV given it ought to be yellow. They're all white. This is for the doctors in the group now. You go in there, the IVs are always clear, right? So why should they be yellow? If you're in the hospital, you're sick, I hope. Or you shouldn't be there. And even if you're sick, they're going to kick you out if you sign on to this new health care plan, but that's another matter. Anybody who's not feeling well, according to this, should be using the B vitamins. Now, why should we be injecting them? Where did that come up? Well, that comes from another study done in a nursing home in New Jersey. A nursing home where everyone was on a supposed good diet, and not only that, everyone was given a multiple vitamin with at least the RDA, which stands for recommended deficiency allowance, you know that. But at least the RDA of each of the B vitamins, and everybody had to swallow the thing too. And then they did these same kind of blood tests, and what they found in that study was that 38% of everyone was deficient in one or more B vitamins, and here they were just measuring the levels of B vitamins. They weren't even measuring what the B vitamins do, which is what the other study I was telling you about did. 38% were deficient, even though they were swallowing the vitamin pills. Then they took a very simple step. They had everybody given a B vitamin injection once a week, and bang, all the deficiencies went away. And remember, these folks were eating a good diet under supervision in a nursing home. This was a nursing home that was not funded by the government, so they had adequate money to feed them properly. They were all taking a vitamin pill, and yet 38% deficient in this home. With a shot, bang, nobody's deficient. So someone comes into our clinic and they're over 65 and we've got some mysterious symptoms. The nurses know automatically that person gets the over 65 award, which is learning how to give themselves a B vitamin shot. Well, why won't we give it to them? Because it's cheaper to do it yourself at home. You don't have to travel to see the doctor. You can buy it if you feel like it from AARP pharmacy or one of those wholesale discount pharmacies. It's a lot cheaper, it's a lot more convenient, and people learn to take it on their own when they feel like they need it, without coming in and paying our nurses. So, what do we go over next, Dr. Gaby?
Can I have one of those shots? I'm getting kind of tired.
Well, my favorite ones are German, and FDA got those.
Okay, thank you.
Well, we just go stand here and
You do a little, I'll do that. Okay. Why don't you rest for a minute?
yeah.
Okay. All right. I wanted to talk for a while about cholesterol. Anybody ever heard of that? Yeah. We have this thing in this country called cholesterol phobia. And it's interesting that when I was going through medical school, dangerous cholesterol was considered 300 and 250 was considered average and acceptable. And now that Mevacor has been approved by the FDA and some other common cholesterol-lowering drugs, the level of safe cholesterol fell to 200. And what we're taught is try diet, getting them off of saturated fat and onto margarine. That's another story, because now the evidence, and we heard this 20 years ago from Roger Williams, but now the evidence in the journals clearly says margarine and the fatty acids from which it's made, called trans fatty acids, also present in partially hydrogenated vegetable oil, increases the risk of heart disease. And the chemistry of it is complicated, but suffice it to say that corn oil and soybean oil starts as a liquid, and after they play with it, it comes out as a solid stick. Now, you don't have to be Louis Pasteur. Now, he was a biologist. You don't have to be Marie Curie, she was a chemist, to know that there's something wrong going on when you change something from a liquid to a solid. The bottom line is that the human body does not know how to deal with these modified fats. It interferes with these hormone-like molecules called prostaglandins, and it interferes with other essential processes in cell membranes. So it was shown back in the 50s, and it has been re-shown today that margarine is dangerous. So what I've always told people is keep your fat intake low, but if you've got to choose between margarine and butter, choose a little bit of butter. And I think the research is going along that line. But back to the cholesterol, we've been told that cholesterol is bad. We've also been told that, if you've got high salt, it's bad, and if you've got high sugar, it's bad, and all this is true. However, what we forget is that cholesterol is also good, and there's an optimal range that every nutrient in the body should be. If your blood sugar is too high, you've got diabetes. If your blood sugar is too low, you die from hypoglycemic shock. If your blood potassium is too high, you run into trouble. If it's too low, you run into trouble. Same is true for salt or sodium. So there are many different factors in your body, and there is a too high and there's a too low. Now, what about cholesterol? Well, we've been taught that cholesterol forms these plaques in our arteries, and yes, it's true that these plaques do contain cholesterol. And way back in 1908, a Russian physiologist named Anichkow fed rabbits cholesterol, and he gave them atherosclerosis, or hardening of the arteries. So we figured, well, the cholesterol is in the plaque. You feed the rabbits cholesterol and they get the plaque. Let's stay away from cholesterol. Well, in 1978, 70 years later, another group of scientists redid the Anichkow studies and found out that cholesterol feeding does not cause atherosclerosis in rabbits. Well, what happened in those 70 years? They assumed that when Anichkow did his work, he let the cholesterol sit out in the open air, and cholesterol is a very unstable molecule, and it forms an oxidation byproduct known as cholesterol oxides, or oxidized cholesterol. And that type of cholesterol is very dangerous to arteries, whereas pure cholesterol in its native unoxidized state did not produce atherosclerosis in the rabbits. The minutest quantity of the cholesterol oxides did. So that brings us up to a very interesting thought, and that is, it's not the cholesterol itself which is dangerous, it's when the cholesterol becomes oxidized that it becomes dangerous to the arteries. And this has now been very clearly worked out, and this is largely why places like Harvard are now saying that taking antioxidants help prevent heart disease. Beta-carotene in the physicians study, 22,000 physicians entered a controlled study where they took either beta-carotene or placebo, and in the beta-carotene group there was a 50% reduction in the number of new heart attacks. That's just from one nutrient, one antioxidant. Another study, the nurses study, and there was another study done in men. They found out between 27 and 46% reduction in heart disease incidence in people who take as little as 100 units of vitamin E per day. A third study using the third major antioxidant, vitamin C, found out that people that take as little as 200 to 500 milligrams of vitamin C per day have a lower incidence of heart disease and a lower overall total mortality than people who don't take the vitamin. So this clearly points to this explanation that if we can keep the cholesterol in its normal state in the body rather than letting it get oxidized, that it won't be as dangerous, and it might not even be dangerous at all in the normal ranges. On the other hand, if you push the cholesterol down artificially with a drug such as Mevacor or Probucol or clofibrate or a lot of the ones that they're using, you will lose the physiologic benefit of cholesterol. Now, what does cholesterol do in the body that's good? Any of you have either estrogen or testosterone in your body? I hope so. Actually, we all have both of those. We think of these estrogen as female and testosterone as male, and that's an excuse for the males acting like males and the females acting like females, when in fact the males do have a nurturing and the females do have a left brain. Is that the proper distinction between male and female? I'm not sure. But anyway, the ovaries manufacture both estrogen and testosterone, and the testes manufacture testosterone, and the adrenal glands manufacture other products which get converted into estrogen in men. So we have both in each body, and the body manufactures them from cholesterol. Okay, how about vitamin D? You go out in the sun here, your skin gets radiated by the sun, and you make vitamin D from cholesterol. Then there's progesterone. Then there's a very important hormone which we will talk about later called DHEA, which has some anti-aging properties. Body makes it from cholesterol. And then there's cell membranes which prevent bad things from getting in and help good things get in. The cell membrane is made partly out of cholesterol. So the point here is, if we artificially lower the level of cholesterol, we are interfering with our hormone production and we are interfering with the repair of our cell membranes. When someone comes in and they've got high cholesterol, maybe it's because their body realizes we need more steroid hormones, we need some cell membrane repair, give me some precursors. So the cholesterol rises as a natural response to the stress that's going on. And then the doctor says, you're in trouble, your cholesterol is 270, which is not even that high really. Take this drug that'll knock it down. What you're doing by taking the drug is you're interfering with the body's adaptive response to the stress. Now that may explain why taking cholesterol-lowering drugs has never been shown to reduce the death rate. Dr. Mendelsohn, who wrote a number of books about alternative medicine, says it doesn't change the funeral rate. It changes the cholesterol, but not the funeral rate. So there are increases in cancer death. And the interesting finding, in 3 or 4 independent studies, there were 3 times as many violent deaths in people who took cholesterol-lowering drugs: suicide, homicide, and accident. Now that makes a lot of sense, because when you're under emotional stress, the adrenal glands are kicking out cortisone and other steroid hormones to deal with the stress. And if you're taking Mevacor or Pravachol or one of these drugs that forces the cholesterol down, you're not going to be able to deal with your stress. So you're going to either shoot somebody, or they're going to shoot you, or you're going to drive off the edge of a bridge. And this has been shown in so many different studies, 3 to 13-fold rise in violent deaths in people taking cholesterol-lowering drugs, that it's got to be real. What is the bottom line here? If your cholesterol is borderline elevated, and I consider that 250 or less, then you should be taking all of the antioxidants: vitamin C, vitamin E, beta-carotene. You don't have to be mega-dosing on them. You can take average doses: vitamin C, 500 to 1,500 milligrams. Vitamin E, 100 to 400 units. It's non-toxic. You can take the higher level. Beta-carotene, 25,000 units would suffice. While you're at it, it wouldn't hurt to take 50, 100, 150 micrograms of selenium. My opinion on that is that the inorganic form of selenium is more effective. It's kind of complicated, but sodium selenite is probably the most effective form. Some people might disagree with that, and we don't really have time to get into the whys. But any form of selenium will help some. And what we know is if you take selenium along the same time with vitamin C, the selenium gets inactivated. So as long as you're taking less than 1,000 milligrams of vitamin C with food in your stomach, it won't matter. But if you're taking more than 1,000 milligrams of vitamin C, or if you're taking it on an empty stomach, you should really take your selenium at a separate time, at least separated by an hour. Other antioxidants: vitamin A is very helpful, but we worry about vitamin A toxicity with long-term use. I've gotten more conservative over the years. I'm satisfied that in people under the age of 50, 25,000 units a day is perfectly fine. People over the age of 60, I'm concerned that 25,000 units in rare cases might be too much, so I usually recommend, for preventive purposes, 10,000 units a day, and if we're treating a medical condition, we go somewhat higher than that. Zinc is also an antioxidant. 15 to 30 milligrams a day is adequate for prevention in most cases. Higher doses are used to treat medical conditions. Zinc should not be taken alone because it causes imbalances with copper. So if you're taking any more than 15 milligrams of zinc per day, you should be taking 1 or 2 milligrams of copper along with that. So back to the cholesterol thing. If someone advises you to take a cholesterol-lowering drug, you want to know, is it going to prolong your life? It probably won't. And in most cases, I tell my patients to go off of their cholesterol-lowering drug unless their cholesterol is above 300. And in that situation, there may be some benefit to pushing it down using medicines. But what medicines can we use? We can use natural medicines. There's something called pantothene. Pantothene is a breakdown product of the B vitamin pantothenic acid. And it is produced in the body, but we can use it medicinally, and because the body recognizes it, it's non-toxic. Pantothene has been used in Italy for the past 15 years. There are a number of research reports from Italy published in American journals and ignored by American doctors, unfortunately, but it is available over the counter. Pantothene, P-A-N-T-E-T-H-I-N-E. It comes in a 300 milligram tablet, and the dosage is anywhere from 2 to 3 tablets per day. Research studies have shown that pantothene alone will lower total serum cholesterol by 10 to 15%, which is not a huge amount, but if the cholesterol is 300, it'll go down to 270 or 255, which is a pretty big change there. It also raises the good cholesterol, the HDL, up to 30%, and that's a substantial change. And it will lower the triglyceride levels. I've seen people come in with a triglyceride of 1,000, which is dangerous, and they go on pantothene, and in 2 weeks, their triglycerides have dropped from 1,000 to 300, which is still high, but substantially lower. And in the research reports, they say you can bring down high triglycerides by between 30 and 60%. Equally important is the fact that pantothene does not have any side effects compared to a drug like Mevacor, which is the most commonly prescribed cholesterol-lowering agent. Mevacor causes elevations of liver enzymes, which is a euphemism for saying it damages the liver. It may cause problems with visual function as well, and it causes a depletion of a very important nutrient called coenzyme Q10. We'll get into this a little bit later. Coenzyme Q10 has now been shown to be life-saving for